survival rates and can decrease relapse rates. So this is very, very important for any cancer patient or survivor. So just moving on into the presentation. So my name is Samara Mahindra. I run a company called Carer, and I have been a part of integrative medicine and integrative therapies for oncology for over 10 years now. Nikat is a part of our team. She provides onco clinical care, and she's a health expert when it comes to oncology. She has worked with over 500 cancer patients, and we have seen profound changes with the recovery of our patients just using nutrition, and then even more so once we integrate physical therapy and psychological interventions as well. So Nikat and I will be a part of this session. We will take you through the entire presentation. If you have questions, please feel free to write it in the chat box, and then we will spend some time at the end of the session to answer a lot of your questions as well. So to start off, some of the major side effects that one faces during cancer and post-cancer, of course, is, appetite, loss of appetite, extreme nausea, vomiting. There is fatigue. Nikat, if you can go back.
Yeah, so sorry.
Anemia, weight loss, neutropenia, where your WBC counts fall. In fact, it's a very, very common diet we create for a lot of oncologists is neutropenic diets for cancer patients, something that a lot of cancer patients don't do, but can have really, really profound changes in their recovery if they were to follow these diet plans, and constipation and diarrhea, and a lot of gut issues. So we are going to actually discuss and talk about each one of these side effects and how we can manage each one using nutrition and lifestyle. So I will now hand it over to Nikat, who will take it forward in terms of going through each side effect and how we can manage it better.
Yeah, thank you, Samara. Okay, so now we'll be talking about 6 or 7 of these side effects and how to manage the same, either in terms of food. Mostly it will be in terms of food, and I would also give you a few tips on how to manage it through physical activity or even yoga. Now, firstly, coming to appetite. Yes, it's one of the most common side effects that I have seen when it comes to cancer patients who are undergoing treatment, or the cancer itself can sometimes cause loss of appetite. So, what you need to do is it's initially what happens is when a person is undergoing chemotherapy, example, he or she ends up losing appetite for like 3 or 4 days, and then gradually they start recovering. So that means they start to get back to their old appetite. So during this period, when you have this loss of appetite, you need to make sure that you eat small frequent meals. Now, because of course you cannot eat like too much at a time. So you need to make sure that you eat small frequent meals, something small for every 2 to 3 hours, so that you don't end up losing your weight, which is also one of the most common symptoms. So what you need to do is you need to eat something, even if it's something small, you need to make sure that it's calorie or nutrient dense. For example, say rather than just eating a small portion of fruit, you can add in a little bit of nuts and seeds. So that'll make it nutrient dense. So that's how, and rather than taking just a plain milk, instead you can add a little bit of dry fruits or nuts and seeds to it again, or maybe a small portion of fruit to it, so that you make it nutrient dense. So you need to make sure that you're eating small frequent meals rather than eating too much at a time. And at the same time, just make sure you do not drink too much of liquids in while eating your food, because that'll instead fill up your stomach and you won't be able to eat more. So you need to make sure that you take your liquids like either half an hour before or half an hour post your food, so that you're able to eat most of the solid food efficiently. And the other ways to improve your appetite can be, you can experiment with different kinds of herbs and spices. For example, instead of just depending on something like vanilla flavor, you can try and add in like different flavors like coffee flavor or sometimes strawberry. So you need to make sure that you experiment with different herbs and spices. And sometimes you can, instead of just eating like something sweet flavored food, you can also add in different kind of spices. Like sometimes it could be a little tangy kind of food, or sometimes it could be a little spicy. So just to, experiment and try with different foods, so that that'll help in improving your appetite in turn. And there are few exercises also, like for example, here I've mentioned one yogasana, that is Shashankasana. And this yogasana will help in improving your appetite and digestive function, and will also help in better absorption of the food. And you can also, if not this in specific, you can also, what you can do is you can try something like a simple walking as well, maybe like in the evening, or when you wake up in the mornings, or whenever you're able to do it. So that'll in turn help in better digestion, and also will help in improving your appetite. So these were like few tips that you can actually use in order to improve your appetite. And also you can also experiment with different colors of the food. So when you see a food, sometimes what happens is your appetite gets simulated. So there is also one way where you can experiment and try to improve your appetite. So the next one is your nausea or vomiting. So how do you improve this is, now in my experience, what I've noticed is the one thing that definitely works out for most of my clients is ginger. So anytime you have that nausea or your vomiting sensation because of the cancer or the treatment, just try to use this ginger. You can take it in the form of a concoction, or you can also make something like a popsicle out of it and use it whenever you have this sensation, and wait for like 15-20 minutes. So when the level of nausea or the vomiting sensation comes down, then you will be able to eat your food better. So that's like one of the remedies that I have noticed in my experience, and that definitely seems to work out on my patients. Or what you can do is, yes, whenever you immediately after your food, please do not lie down. It's better you would rather sit for some time upright, so that your food gets digested well. Or you can also give a gap of 15-20 minutes post your meal, and then take a simple walk, so that your digestion is better. So that will ensure that the food gets digested and doesn't come out. Or sometimes if your nausea is very severe, just try with something like ginger concoction. If not able to tolerate ginger concoction, you can also go for some clear liquids like tender coconut water, or maybe something like even clear fresh fruit juice. So if you're able to tolerate that, then maybe you can move on to full liquids, such as buttermilk, or say something like a milkshake. Now, if you're able to tolerate better these full liquids, then maybe you can move to semi-solid and then to soft diet. So this is how basically what they do when a person has severe nausea while you're admitted at the hospital. But if you're able to tolerate the solid foods, and just try with the ginger concoction, that seems to definitely help out. So that's about the nausea, vomiting, and of course, yes, if it's very severe and if you're not able to tolerate, just try and take the medications that the doctor has suggested, something like Emised. Yeah, this is one of the recipes that you can try. This is a ginger mint popsicle. And actually, we have made one recipe book in specific to people who are undergoing cancer treatment. So I'll be sharing the link to the recipe book, and I'll tell you a few things about the recipe book as well at the end of our session. Yes. And oh yes, so now how to manage your anemia while undergoing cancer treatment. Now this is also one of the side effects that you see, maybe like in between while you're undergoing cancer treatment, like post your 2 or 3 cycles of chemotherapy, you will notice this as one of your side effects as well. So what you can do is, over here, you need to make sure that you do include iron-rich foods on a regular basis. Now, when it comes to iron-rich food, yes, foods like, egg, fish, or chicken, nuts and seeds, or say pulses and legumes, green leafy vegetables. These are few foods that are very good sources of iron. But in order for this iron to get effectively absorbed in the body, you need to make sure that you include good amount of vitamin C. For example, rather than just taking greens, what you can do is just squeeze some lime on top of it. So this will ensure whatever iron is present in the greens is better absorbed through vitamin C. Or maybe like post your meal, just take a small cup of lemon juice. That will make sure that whatever food you have eaten and the iron content present in the particular food item gets better absorbed. Or like one remedy that I have noticed with my experience definitely helps out in improving the hemoglobin level is having a glass of beetroot and pomegranate juice on a regular basis. So this juice has worked wonders with my patients. In a week or two, the hemoglobin level seems to improve like at least by 1 unit. So this is something that you guys can try if something is if somebody is suffering from anemia, or you can also suggest it to your colleagues or your friends or your family members. Yes, another thing is now when it comes to veg foods, what happens is, say something like even pulses or legumes or brown rice or quinoa, the nuts and seeds, there is a little bit of phytates or phytic acid present in these veg food items. Now, this phytic acid will hinder the effective absorption of iron in the body. So in order to reduce the phytic acid or the phytate content in the veg food items, you can either soak that food for some time. For example, our moms or grandmothers or our family members might you must have heard them saying, soak your nuts in water for some time before consuming. So that is to reduce the phytic acid content in the nuts so that the iron absorption is better. So that, or you can also roast the nuts and seeds before consuming so that there is effective absorption of iron from these nuts and seeds. So this is about the
Nikat, can you go back to the recipe, because I think a couple of people didn't get to see it. So if anyone wants to just take a picture of this, please feel free. And like Nikat had mentioned, we have a specialized cancer recipe book that we have built specifically for cancer patients and survivors, and we'll talk about that in more detail later. That gives you multiple more recipes that you can follow for your actual pain point or side effects that you're going through. So we will speak about that later. You can go ahead, Nikat.
Yes. Now, fatigue or weakness is also one of the other symptoms that most of my clients end up feeling. So you need to make sure that you're eating good amount of calorie dense food. As I mentioned previously, you need to make sure something small for every 2 to 3 hours is being eaten if you're not able to eat too much at a time, in order to make sure that your muscle mass is maintained. Now, if you're not eating good amount of protein, then that could be one of the reason as to why you could be feeling fatigue, apart from it being the side effects of the chemotherapy or the cancer treatment. Or it could also be as a result of low hemoglobin or anemia in your body. So so it could be these two reasons, or otherwise what you can do is just avoid taking a lot of caffeine in the fluids, and you need to ensure that you're drinking good amount of liquids throughout the day in order to remove all the toxins from the body. And just do not skip any of your meals in case if you're not able to eat too much at a time. And in case if you're not able to eat too much at a time, you can also rely on these protein powders or protein supplement, but you need to make sure that you're choosing the right one. It depends from person to person again, so individual to individual. In case if you guys need any more guidance on how to select the right kind of protein for yourself, or the right kind of protein powder for yourself, you can further get in touch with us. Or yes, now there are a few strength training exercises as well that you can implement in your daily life that can help in combating fatigue at the same time. So, and at the same time, you need to also make sure that you're having good amount of sleep at night, because it's not just the food that will have an impact on your body, but it's also your sleep and your physical activity. And in case if you end up taking a lot of stress, that can in turn have a negative impact on your body. Because if you guys attended the last session, I had also mentioned that your mind has a direct impact on your gut. So if you're in case taking a lot of stress, then that'll in fact have an impact on your gut, and your gut might not be able to absorb the food effectively that you're eating, or your appetite can also go down because of the mental stress that you take. So that's about the fatigue. Yes. Now diarrhea. Now, why it happens is it could be one of the side effects of the treatment, or sometimes what happens is your stomach gets too sensitive to the kind of food that you eat due to the treatment, and it might get a little too sensitive to the lactose that is present in the milk, or to the gluten as well sometimes that is present in the wheat. So it depends from person to person again. Now, how do you manage this diarrhea is basically, I'll tell you a little bit about the fiber. Now, there are two types of fiber. One is called a soluble fiber and the other one is an insoluble fiber. Now, in case if you have diarrhea, you need to make sure that you include good amount of soluble fiber, which is present in the pulp of the fruits. Or basically, you just need to remove the skin and the seeds of the fruit. Now, for example, if you're going to have something like, say, apple, you need to just have the pulp of apple and remove the skin. So the pulp constitutes the soluble fiber, and the skin and the seeds will constitute the insoluble fiber. So when you have diarrhea, you need to make sure that you take good amount of soluble fiber and avoid the insoluble fiber, because the insoluble fiber will increase the bowel movement. So that is one thing that you can apply. And as usually, you'll have to take something small for every 2 to 3 hours. And because when you have diarrhea, there are chances that you might end up losing a lot of electrolytes and fluids. You need to replace the same. So you can have good amount of tender coconut water, or say something like, add in a little bit of extra salt in your food in case if your sodium levels go down. Or maybe you can have one small banana in order to replace the potassium that you have lost. So you need to make sure that you're eating or drinking good amount of liquids throughout the day, and avoid foods or drinks that can make your diarrhea worse. As I just said, avoid the insoluble fiber because that can make your diarrhea worse, or avoid taking a lot of fatty food items or spicy food items. And yes, now drinks that have got a lot of sugar, such as soda and fruit punch, because sugar also can cause a lot of havoc in your body. Now, especially when it comes to something like fructose as well, in case if your stomach gets too sensitive to it. Or something like, even lactose, which is present in the milk or dairy, can sometimes cause when a havoc in your body if it becomes too sensitive. Just a minute. I'm so sorry for that. Yes. So, like, these are the foods. This is how you manage basically diarrhea in terms of food. And yes, coming to constipation, you need to ensure that you're taking good amount of liquids as well over here, because that will help in movement of the stool outside the body. Or over here, as I was mentioning about the soluble and insoluble fiber, you can eat both the kinds of fiber in order to get relief from constipation. And yes, one of the remedies that I have noticed seems to help is a glass of lukewarm water with a tablespoon of ghee. So this either right before going to sleep at night or when you wake up early in the morning, it helps in easy or in providing relief to constipation. So this is also one of the remedies that you guys can try, or you can have some hot liquids, or you can also include something like isabgol, which is nothing but the soluble fiber again. But you need to make sure that you're drinking good amount of water whenever you take isabgol or the psyllium husk. This is also one of the remedies for constipation. And yes, now there are a few other yogasanas that you can try that might help in easy bowel movement, like Malasana is also one of the yogasana that you can try, or Muktasana will also help you out. So, and people with certain types of cancer should not eat a lot of fiber again. Although I told that you can eat a lot of fiber when you have constipation, but if you have anything in specific with gut issues going on, and if you have undergone any kind of surgery, then yes, your diet will have to be changed accordingly. That again will depend from person to person.
So maybe we can just stop for a second. If anyone has any questions, Shamik, maybe if you want to take any questions right now.
Yeah, so I think there's one question, couple of questions from Tanvi. So she asks, if you are overweight with breast cancer, can you touch upon any post-treatment? What advice is there to lose weight? And also, I think, is it recommended to avoid dairy and non-veg, gluten, coffee, tea completely for cancer patients because they're inflammatory?
Yes. So what you can do is, see, you don't have to avoid dairy or a lot of gluten. Now, when it comes to dairy, as we had discussed last time as well, it depends from person to person again. Now, in your case, example, if you were the case of ER positive, or if you were too sensitive to estrogen positive, then yes, it's better you avoid dairy, because that has got a little bit of hormones present in it. But otherwise, you would rather go for organic milk products rather than having the conventional ones, because usually these cows, when they are reared, they're given a lot of hormones, and those hormones are not destroyed even when you cook or boil the milk. So you would rather avoid conventional milk. And take organic milk in case if you're not sensitive to estrogen. But in case if you are sensitive to estrogen, if you were diagnosed as ER positive, then just be a little careful and avoid the dairy. And when it comes to gluten, as I had mentioned even last time, the kind of the wheat products that you're getting these days, they are genetically modified, and also they are manipulated, actually used, have been subjected to a lot of chemical fertilizers or pesticides. So you would, in case even if you do have gluten, just make sure you do not end up eating gluten for all of your 3 meals. Maybe like for one small meal in a day is more than enough. The other times, just make sure you have variety in your diet. You can go for other unpolished grains, or you can rather avoid grains and go for something like, a meal that is made from a good amount of veggies in it, and something like fish or organic chicken or egg. So this can also help in losing weight. So basically, you can try a low carb diet. The sample diet plan that I had just shared the last time can also help you out in losing weight. Or in case if you need a specific diet plan in order to lose weight, you can also get in touch with us, and I'll be able to help you in giving you a personalized diet plan. But you need to make sure that you do not have a lot of fat percentage in the body, because having a lot of fat percentage in the body is also one of the risk factors for developing or for having breast cancer. So just be a little careful with that. Okay, hope I have answered the question. Shamik, any other questions, or do we?
Yeah, is soya to be avoided completely for all cancers or just for the estrogen sensitive ones?
Yes, so as you just mentioned, just for the estrogen sensitive ones, but otherwise, the ones who are not sensitive to estrogen can have organic soybeans and not the genetically modified ones. So in fact, a few of the research articles also say that you can have soya, which in turn, it has got a little bit of polyphenols as well in it, or say the ones that help in fighting against the breast cancer in specific. So yes, you can have soybeans as long as you're not estrogen sensitive, but just again, as I said, always remember moderation is the key. So no matter what you eat, do not binge eat on anything. Make sure there's variety in your diet.
Okay, and if you have to like, which are the foods that folks who are estrogen sensitive they should avoid? What's the list of that? Like, one is soya.
Yes, or dairy, because that has also got a little bit of hormones in it. And these are few foods, two most of the common food items that has got a little bit of estrogen, not a lot. But in case if you're sensitive, maybe you can avoid these. Or apart from that, there are other foods like, alfalfa sprouts. So that has got a little bit of estrogen as well. Or apart from that, sesame seeds has also got a little bit of estrogen in it. So, but then because these are like few food items that are hardly taken and not used on a regular basis, there's no harm in taking these or in taking this on and off here and there during the week. Or so, and apart from that, just make sure you do not use any kind of plasticware at your home, because that can also because it is also a type of xenoestrogen, and that can cause a havoc in the body. Or apart from that, just make sure you use clean makeup or skincare products, because that has also got a little bit of BPA and sulfates and phthalates and parabens, and these are again xenoestrogens. So these are like few things that you'll have to be really careful about. But in
Maybe
order
we
to
need to just explain to them what xenoestrogens are, because that's really important.
So that, and in order to reduce the excess estrogen in the body, you can try with cruciferous vegetables. This has been shown to reduce the amount of estrogen in the body. So maybe something like cabbage, cauliflower, broccoli, or something like kale or watercress, whatever you guys are comfortable taking, have these on a regular basis, because this has shown to reduce the excess estrogen levels in the body. And good amount of physical activity will also have a definitely good impact and reduce the fat tissue in the body or the fat percentage, because that is also one of the things that helps in releasing estrogen, because fat releases estrogen in the body. So you need to make sure the fat percentage is always maintained or towards a lesser side.
So usually we will see like a lot of breast cancer patients who are ERP positive will probably be a higher fat percentage, high stress levels, nutrition is not 100%, and that's why estrogen levels are high. So it's very light. But what I was saying is, if you could just explain, really quickly, what are xenoestrogens?
Yeah, so these are a few specific compounds that are present in our daily life products. For example, as I just mentioned, it could be either the plastic or say something like, our makeup products that are artificially induced in these food items. And the artificial plastic wares or the makeup products, and that can help in releasing extra estrogen in our body. And because if you're already sensitive to estrogen that is released in the body, these xenoestrogens, if in case it enters through your plasticware that you use or through the makeup products, can cause havoc in the body by releasing more amount of estrogen. So these are these are xenoestrogens. These are basically the artificial compounds that enter into your body through the environment. Okay, so hope I have answered that question. Anything else?
I think you can go ahead.
So yes, now muscle mass. So most of the cancer patients also that I've come across end up losing a lot of muscle mass, either from their bicep, triceps, from their thighs, from their calves. So apart from losing their fat mass, they also end up losing a lot of muscle mass from their body. So it's very important that you either maintain your muscle mass or help your body in improving the muscle mass. And you need to include good amount of protein rich foods for that. And how much is enough is you need to take like at least 1 gram of protein per kg body weight. So in case if you weigh 60 kgs, you need to make sure that you're eating at least 60 grams of protein per day. Now, say, for example, if you're undergoing intense cancer treatment, then your protein requirements will actually increase. And that again depends from person to person. But you need to make sure that you're taking at least 1 gram of protein per kg body weight. So if you weigh 50 kgs, then you need to take at least 50 grams of protein in a day. And also it's not only the amount of protein that you take, but also the kind or the quality of the protein that you eat. Now, for example, say there are two kinds of protein. So there is the essential protein, and then the protein that comes from your wet sources. For example, your pulses and legumes and your vegetables and all of these. Now, this kind of protein is incomplete protein because it doesn't have all 9 essential amino acids in it, and the absorption is not that really great when it comes to these kind of sources. But if you actually see sources like eggs or fish or chicken, so these have got like most of all 9 essential amino acids in it, and the absorption is always better from these sources when compared to veg. So what I would recommend is take both in combination, and please don't avoid your eggs and fish or organic chicken completely from your diet while you're undergoing cancer treatment as well. And yes, apart from that, you also need to make sure that you're eating a balanced diet, because you also need micronutrients coming from your vegetables and greens and microgreens in order for your body to metabolize the protein. So you need to make sure that you eat a balanced diet rather than just concentrating on the protein. And yes, in order for your stomach to absorb the protein effectively, you need to make sure that you're maintaining a good gut health. So for that, as I had mentioned, even in our last session, we need to include good amount of probiotic, which is nothing but the live bacteria in terms of food. So something like fermented food products like buttermilk or curd or yogurt on a regular basis is a simple example that I can give you guys. And yes, you can also practice strength training exercises. Few physio exercises or even yogasanas can actually help in improving your muscle mass and decrease the level of fatigue. And one of the other reason that is very important for you guys to maintain good amount of muscle mass is your immunity. If you're not going to maintain good muscle mass and your muscle mass keeps dropping, then your immunity will keep dropping. So you need to make sure that you're eating good amount of protein and maintaining your muscle mass so that your immunity also stays on par. So
Any good sources of protein for vegetarians that you would recommend?
yes, so one will be your nuts and seeds, definitely, and because those are like good sources of protein. At the same time, they're low in carbs, good in fiber, good in good quality fat, and other micronutrients as well. Apart from that, pulses and legumes is also a very good source of protein for vegetarians. And although they do have a small portion of carbs coming in apart from protein, and also apart from that, yes, curd or yogurt is also a very good source of protein. And yes, a little bit of soybean you can include in your diet, or quinoa is also a good source of protein. Or you can also use a little bit of tofu, which is nothing but the soybean paneer that is made from soybean. So things like this are like good sources of protein for vegetarians. Or when it comes to vegetables, say something like mushrooms or cabbage, cauliflower, broccoli. These are also like good source of protein in terms of vegetables. So you can include even these on and off on a regular basis.
In
So
terms
because
of oil, do you have any specific recommendations on like groundnut oil or any other type of oil?
Well, as I had like specifically mentioned even last time, go for cold pressed oils rather than going for any kind of refined oils. Now, even if it's cold pressed oil, seed oil is something that I wouldn't really recommend because that causes inflammation in the body. that has got like a lot of omega-6 fatty acid in it. Now, in Indian diet, if I have to tell you, we end up taking a lot of omega-6 fatty acid and very less of omega-3. Now, that is also one of the reason why there is a lot of inflammation in the body, and long-term inflammation, as I had mentioned even last time, can cause cancer in the future. So go for something like, cold pressed or extra virgin avocado oil or extra virgin olive oil, or something like cold pressed coconut oil, rather than just relying on any kind of seed oils. Yes, you can use those, but make sure they're cold pressed, but as a variety in your diet, again, not too much in every meal of yours. And ghee is also a good source of fat. If you do not want to use oil, you can use ghee for just simple shallow frying as well.
Okay, so seed oil means groundnut oil or
Mustard seed
sunflower
oil,
oil.
exactly.
Okay.
Yeah.
These should be limited
Yes.
because they have long-term influence. Got it.
Yes.
And what about butter?
Butter, yes.
Okay, so Tanvi has a very interesting question. I get this a lot, which is, can we consume raw vegetables while chemotherapy is going on, like cucumber, tomato raw? And can a green veg juice be consumed daily, like celery juice and or doobie juice?
Sorry, can you repeat that question, Samara?
So Tanvi has a question saying, can we consume raw vegetables while on chemotherapy and raw green juices on a daily basis?
Okay, so so now I'll be talking about another point which is called as neutropenia over here. Now, what happens when you're undergoing cancer treatment is sometimes the level of neutrophils are nothing but a kind of white blood cells which is present in the body, and that helps in our immunity. Now, while you're undergoing chemotherapy or cancer treatment, the levels of neutrophils in the body can drop. It while it doesn't happen with everyone, this is case with some of the cancer patients. So when your neutrophils level drop, there is a chance that you easily get susceptible to infections. So that is the point where you have to avoid consuming a lot of raw fruits or vegetables or even cold pressed juices for that matter. Or otherwise, if your immunity or your neutrophil, your WBC levels are on the normal side, then you don't have to really avoid any of the raw fruits or veggies, because you get most of the micronutrients from there. So, and some of the vitamins, like, the water soluble vitamins like vitamin B or vitamin C, can easily get destroyed while you're cooking. So these are, these are better absorbed in your body and available easily to your body when you consume them raw. So I wouldn't actually recommend completely avoiding raw fruits and vegetables as long as they are fresh and organically grown and they're washed or scrubbed well before consuming. So yes, so I hope I have answered the question.
Yeah, there are a couple of other questions. I mean, in terms of, you mentioned olive oil, right? But can you
Yeah.
use olive oil for frying? Extra virgin oil, can you use it for frying?
Okay, no, if it is really a extra virgin olive oil, if you see the smoking point of extra virgin olive oil is will be in 200 plus. So that means yes, easily you can use it for shallow frying as well. But if it's something that is manipulated and if its smoking point is low, then of course you cannot use it for cooking. But as long as it's pure and it's extra virgin olive oil, yes, you can use it for shallow frying as well.
Okay. And do you recommend whey protein powder, etc.? Any of these protein powders, any type of protein powder for vegetarians, especially?
Yes, you can, but again, it depends. Like, for example, somebody just asked me if you're ER positive or estrogen sensitive, can you use that whey protein? No, whey again has, because it's a product that is available, made available from the dairy or from the cows, there are chances that it can have a little bit of hormones in it. So I wouldn't really recommend them to go for whey protein. Or sometimes what happens is, because of the chemotherapy treatment, your stomach gets a little too sensitive and you might not be able to digest the lactose that is present sometimes in the whey protein. So I usually recommend them to go with the plant protein, which is a better option and a safer option. But yes, in case if you are able to tolerate whey protein, then yes, you can. But again, it depends from person to person.
Somebody is not on mute who should be on mute.
That's me actually. Oh, there's some construction
Okay, okay.
one right next to my apartment. So
Okay, 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 cool.
yeah. Yeah, so that and yes, now coming back to neutropenia, if I have to tell, apart from raw fruits and veggies, you need to make sure that the other food items that you consume, especially when it comes to something like eggs or fish or chicken, you need to make sure these are cooked well before consuming, and do not take even raw nuts if you have been using the container on and off again and again, because you're already susceptible to infections. So you need to make sure that you roast those nuts as well a little before consuming. And fruits and veggies, just make sure you wash or scrub them well. Or if you have to consume the fruits, if your neutrophil levels are low, then you can go for thick skinned fruits like something like orange or watermelon, or something like sweet lime, rather than going for thin skinned fruits, because there the susceptibility to infection is a little higher. So that's about neutropenia. Now, any other questions?
Any brand you will recommend for plant-based protein?
Okay. I usually go with something like Oziva. There is this plant-based protein powder that they have without any artificial sweetener, without any artificial flavor, and no preservatives as well. It's just the pure protein powder, pure plant-based protein powder. So that is something that you can go for. Or we are in work actually to bring about a protein powder of ours. So once that is ready, we can tell you as well, and you can tell it to your clients. That is going to be again pure plant-based, without any artificial flavors, no colors, no additives, just going to be pure plants. So yeah, something like this you can go for while choosing the right kind of protein powder.
So just for the people who missed it, you can go to Aziva, which is a vegan protein powder, or Neutralite from Amway. But honestly, there really isn't any very great protein powder for cancer patients at the moment, and that's why Nikhil said that we will be creating our own, and we will definitely let you all know when that's out. That should be out in a month or two. We have really tried to identify what is the required protein for the patient and really the cleanest source of it. So we have been working on this for a while now, and we'll come out with the same.
Yes. Okay, so moving on, the next segment is how to detoxify your body post-treatment. Now, over here, as and when your body starts recovering from the cancer treatment, your body itself will detoxify, and you don't have to provide anything in specific for that. Now, but yes, definitely you can help your body in detoxifying. So you by including few foods like lemon, ginger, a little bit of basil, or a little bit of beetroot, because these foods have got a few specific compounds in them that can help in eliminating the free radicals from your body, or detoxifying your liver and kidneys in specific. And you need to make sure that you're drinking good amount of liquids throughout the day in order to help your body detoxify. And you need to free yourself from any kind of refined or processed food, especially sugar. And yes, juicing, as I just said, you can have fresh pressed juices, or not necessary that you have to take fresh pressed juices, but yes, something like even soups, or something like tender coconut water will also do the work. And yes, a good sleep, and yes, good amount of physical activity as well, because physical activity while you're doing it also helps in sweating, and sweating is also one of the ways wherein your skin detoxifies itself. So yes, good amount of physical activity also is very important. And practice stress reduction techniques like a few of the breathing exercises, or few yogasanas, or chanting, something as simple as chanting, that can help in reducing the stress. So like these are few tips that you can just use to help your body in detoxifying, but your body is very much capable of detoxifying itself. So you don't have to really go ahead and practice some extreme diet in order to detoxify your body. So yes, that's about the detoxifying. And yes, there are a few myths and facts that I have come across. Yeah, sometimes like people think that cancer is contagious, but it's not so. So but yes, if you do have any kind of virus in the body, say something like hepatitis B, due to which a person is suffering from cancer, then yes, it could be contagious. But otherwise, if it's something like breast cancer, cervical, colon, lung cancer, no, I would say cancer is not contagious, and you don't have to worry about it being spread to others from you or from others to you. And then the next one is a
So Nikat, sorry. So yes, breast cancer is not. Cancer is not contagious. Neither is breast cancer. It's genetic. There are cancers that can be influenced by the genes, but it is not a contagious disease. I think most people know this now.
yeah. So the next one is microwaving plastic containers and wraps releases harmful chemicals. Now there are a few specific plastic containers that are meant to be used for microwaving. So if you're going to use those containers, then it doesn't release any harmful chemicals. But if you're going to use any cheap plastic container, then yes, that will definitely release the harmful chemicals in the food that you're going to eat. So use only those specific containers that are meant for microwaving, or you would rather go for something like Borosil or something made from glass rather than using any kind of plastic containers, because those are the safest options. Okay, moving on to next one. Cancer will always come back. No, this is not true in every case. Now, I have seen people who have had like cancer once and who were able to survive for the rest of their lives without having any recurrence. So it's not true. The cancer will always come back as long as you're maintaining a healthy lifestyle. So in case if you have had cancer and if you're a survivor, just make sure you maintain a very good healthy lifestyle in order to avoid the recurrence of cancer. The next one is soy products can increase the risk for breast cancer. Now, as this one we have already discussed. As I said, just make sure in case if you are estrogen sensitive, then maybe you can avoid the soy products. But in case if you're not, then you can have soy products, but not the ones that are genetically modified, but organic soy products. Just make sure there's variety in your diet, and moderation is the key. So just make sure you can have soy, but in a small portion size, not on a regular basis again, maybe like once in 2 or 3 days. So that will ensure that not one specific food will have a very any kind of negative impact on your body. So moving on, I should not consume dairy or any animal products. As I just told a few seconds back, you can have dairy or other animal products as long as the source is clean. So you need to make sure that the dairy or the animal products that you're getting is clean, as in it's organic and it's not being given any kind of hormones or steroids. So if that's the case, then yes, you can definitely have dairy or other animal products like egg or fish or chicken, as long as it is organic. The next one is if you have a family history of cancer, you will get it too. This is again not true, because in case even if you have had your mother or your father or your siblings having cancer, it's not necessary that even you will definitely have cancer, because genes do play a role, but they play a very small role, maybe like about 10 to 15%. The rest of your risk factors actually, if you see, comes from the lifestyle. and I've been doing a lot of research on this as well. Your lifestyle plays a very important role in modifying your genes as well. But if you are maintaining a very healthy lifestyle, and if you even if you have had genes, then if you're maintaining a very good healthy lifestyle, then your chances of having the risk or developing any kind of cancer in the future is actually reduced a lot. So it's very important that you concentrate on your lifestyle in terms of your food, your physical activity, sleep, and stress levels. So it's not true in every case.
However, if there are like breast cancer and colon cancers are also quite genetic, so we do recommend, if you have it in the family, to do your screening, because that's very important as well.
Yes. So yes, coming to skincare again, and this, as I just talked about like few minutes back, these days the kind of skin products that we are getting contain a lot of toxins in it. For example, like these, like sulfates, parabens, phthalates, PCBs. These are xenoestrogens, and the other ones, like the triclosan, or say something like a polyethylene glycol, lead. So these can cause inflammation in our body if you're going to use any kind of skincare products having these toxins over a long duration of time. So you would rather go for better brands like Pahadi Local or Tinge or something like Juicy Chemistry, something that's a little cleaner when compared to the other skincare products that is available out there. Yes. So any questions?
One question about some of the household cleaning products beyond skincare, right? So those also have a lot of chemicals, right? Is that something to be wary of, or because they are not really in contact, that's why it's okay?
Yes. So one, they're not really in contact, so it's completely fine. And if you're going to use it on a regular basis, you need to make sure that, the amount or the portion size of those cleaning products just do not exceed the limit. As long as you're using in small portion sizes and how much ever is required, I think that will do.
Got it. Okay.
But in case of even like, these days I see a lot of products that claim to be organic as well. So in terms of the other cleaning products that we usually use at home, like the floor cleaning, for example. So in case if that is something that is really effective and it's suiting, then why not?
Got it. Okay.
Yeah. Now, yes, no, few of the questions that we usually face is, how long does it take to recover from the effects of chemo? So this actually, while you're undergoing treatment, again, depends from person to person, and also post the treatment as well. But yes, the lifestyle over here plays a very important role. Now, I have seen people who were undergoing treatment, and they came to me. So while they were undergoing treatment, but while they were not really following any lifestyle prevention, they used to have these side effects over a long duration of time. And that in turn had caused a lot of havoc in their body. And they, even to the extent that they had to avoid the chemo cycle. But when they came to me, and while I was able to help them in how to monitor these side effects, or how to reduce the side effects in terms of lifestyle, in terms of their foods, that the kind of foods that they were eating, or the stress levels, or simply by following even something like breathing exercises or some simple yogasana or a simple physio exercise, they were easily able to reduce the duration of this side effect. And the efficacy of the side effect is what also I can tell you. So yes, the lifestyle plays an important role over here, even while you are undergoing cancer treatment. So take it from me, I have seen a lot of improvement with my clients when they were following all of these small things in terms of lifestyle prevention. So yes, again, depends from person to person, but it definitely has an impact. Okay. The next question is, what are the long-term side effects of cancer? Now, usually it's something like, hair loss, or few of the organs might get affected when you are undergoing cancer treatment, but it doesn't happen with everyone. Usually, side effects like nausea, constipation, something like rashes, it all goes away within few weeks or few months. But when it comes to long-term side effects, like some side effects that can treatment side effects, like the ones that are affecting particular organs in your body, like your heart, your kidney, or your reproductive cycle, is something very rare that I have seen, and it's not really common. So it again depends on the kind of drugs and the dosage of drugs that the doctor uses on you. But it's very rare that I've seen the long-term side effects of cancer, unless there was some part of your body that was removed, like for example your limb, or say a part of your gut, or a part of your stomach that was removed. So apart from this, there have not been any long-term side effects that I have seen in most of my patients. Yes, so those are the things. Any questions pertaining to the those topics that I just talked about?
There are some questions like any supplements that you recommend for consuming daily for post-treatment cases like multivitamin or vitamin C.
Okay. Now, one, as I said, as long as your body is in a good condition and it is able to absorb the food that you're eating effectively, you don't really need any supplements as such. But you need to make sure that you're following a balanced diet in terms of your protein, your carbs, your fat, and micronutrients is very important. So, in case if you feel that you're not eating your food properly, your body is unable to digest your food or absorb the food well, or in case if you have any deficiency, yes, if that is the case wherein you can have that particular supplement for that particular deficiency, and it depends from individual to individual.
Okay. And do you
So over
recommend
here,
oral
sorry, I
supplementation or
interrupted.
IV treatments?
It's oral treatment. Like for example, like few of my patients I have seen is are deficient of vitamin D, so which is very common these days. So in case if you're deficient in vitamin D, then vitamin D supplement is something that you can take. But as long as you're not deficient in any other vitamins and your body is able to digest or absorb the food that you're eating effectively, then you can correct those deficiencies in terms of food rather than taking those supplements. But initially, yes, in case if the deficiency is a lot, then yes, you can have few supplements along with the food products. But later in the future, I would always recommend to correct those deficiency or maintain or improve the deficiency in terms of food rather than relying a lot on the supplements.
Okay. And one specific question, how do you get rid of neuropathic pain in feet as a side effect of chemotherapy?
Okay, so
Okay.
I can take this one. Can you hear me clearly, Samik?
Yes.
Okay, so neuropathic pain is a very common side effect of treatment. So a lot of people worry that their fingers and toes, and sometimes even the entire hands and feet get very numb, and this can be dangerous because it can get quite excessive. So even walking and balance becomes an issue. So number one is there are actual exercises that you can do, and this is something we can send to them, where there's certain exercises that can be done to just stimulate the nerve endings in the fingers and the toes, and that can really help with neuropathy. Another thing is that also you have these you get these squeezing balls. I mean, they were called stress balls. So that's also something that you can use on a regular basis and actually help in squeezing the fingers and the toes. So you can put these balls under your feet and squeeze the toes on a constant basis. Do it at least 2 to 3 times in the day, which can help neuropathy to a large extent as well. So there are certain exercises, there are and certain movements you can do. Um, but squeezing of the fingers and the toes are very basic things that you can get the patient to do 2 to 3 times a day that can help with neuropathy. In terms of topical therapies, there are certain things that can be done. In fact, I think Alka, someone had asked about CBD again. So Alka, it was not us who was starting CBD. It was, I was talking about my husband, and in fact, he's here. So I will have him come in later for a couple of minutes to just tell you all how it can be used for neuropathy. It can be used for other conditions that a lot of cancer patients are using. So we can discuss that in more detail in a bit.
Yes. So yeah, so from here, Samara will again take over.
So, any more questions, Shamik, that you would like us to answer? I
Yes,
think that yes, done.
there are a few. There's one about doing home enemas for detoxification. Does that help?
Nikat, do you want to take that? I wouldn't recommend it, but Nikat, you can take it forward.
Yeah, actually, even I wouldn't recommend it. How is it that you're gonna prepare the home enema? Is what I want to know. Are you going to take a part of a stool and put it inside your body and then bring it out? Is that how you're gonna do? Or you're gonna take something like, oral home enemas to detoxify. Now, what happens is, see, if you're gonna do these enemas that you usually take, it removes every thing from your intestine, including the beneficial or the good bacteria. So I wouldn't really recommend those kind of treatments to detoxify your body on and off. It's not really a healthy way to do it. No.
Okay. Now somebody is asking that there are different types of cancer is seen in my mother's side relatives for the last 3 generations, right? I mean, how to handle this and what do you suggest?
Okay.
So in this situation, I think again, just sticking to the screen. So it depends the type of cancer. So like I said, breast cancer, colon cancers, these are quite genetic. So recommend you to, let your physician know and to actually just do your preventive screenings on a regular basis. So these prevention screening mechanisms are something that you can see what, because each type of cancer has a different screening that you can do for it, and just be regular with the screening.
Okay. And Jinal is saying my mother underwent chemotherapy and surgery for esophageal cancer a month before. Are there any precautions she should take eating wise?
Okay, so that would again depend if the esophagus is removed or not, or if the esophagus is still intact. Now, even if they do remove the esophagus, what they do is they pull in a part of the stomach and they make that as esophagus. So, as long as that is working effectively, then you don't have to worry about any other complications from it, because it doesn't really act in or help in absorption of any kind of food items, the esophagus. So no, as long as they have pulled in the part of the stomach and made that as esophagus, you're good to go.
Okay. And probiotic supplements, does that help post treatment? If so, any brands that you can recommend? How long can you take them for?
Yes. Now, one I would recommend, in case if your gut issues are too sensitive and there's a lot of things that are going on in your gut, then yes, initially you can rely on the probiotic supplement. But yes, moving on, as and when you move forward or move ahead with your life, I would suggest you go for probiotic from foods, as I just mentioned, from something like yogurt or curd, or something like fermented teas like kombucha, or something like even sauerkraut, which is nothing but a fermented cabbage, or things like this will have a better impact on your body. So that is what I have seen with my personal experience. So go for these kind of food items rather than just relying on the supplement, unless you really need it in the initial stages. So yes, now if I have to talk about brands, then maybe you could go for something like Wow Nutrition, WOW, or maybe even something like Pure Nutrition.
Okay, cool. I think we can move on for now and we'll see if there are any other questions.
All right, so very quickly, I would like to just run you through what we offer in Carer, because we specialize in oncology. We really work with patients through all the stages, through their treatment and remission, and even if it's in a palliative stage as well. So this is just very quickly. This one of these things could be useful for you or a family member. So I wanted to talk a little bit about it. So the first thing that we do offer is we had mentioned to you that we have a cancer recipe book. Now, this recipe book is really honestly one of its kind. There are no cancer recipe books in India. And honestly, we created one because of the fact that we were not able to recommend recipe books to our patients, which was adapted to the Indian space, right? So there are a lot of cancer recipe books, but those that our palate can enjoy was very difficult to find. So we would have to actually create our own recipes and provide it to patients, which we still do. But today we have a fabulous recipe book out there. It's a great one to use if you're going through treatment, if you're post treatment, and to gift to a cancer patient, because it's very, very helpful. We have multiple over 80 recipes, and very easy to do. This is an online version. We can send you a physical copy as well. Now, this recipe book really segregates all the pain points. So like someone had asked about esophagus cancer, so that person might be on a liquid diet or a semi-liquid diet, or you might have a gut issue, or you might have extreme nausea. So what we have done is we have segregated it based on the pain points, and then actually told you exactly the kinds of recipes and the foods you should be eating and how to make it. And they're all very, very easy to make. So I really urge you guys to look at this, because cancer diets are not boring, they're not bland, they're not 100% vegan. They can be adapted, they can be to every palate. It can be really delicious and easy to make and nutritious at the same time. So we have created this book. It has taken us months. It was some of the best chefs in the country, oncologists and nutritionists who worked on this book. The next So please have a look. We will send you links to all our programs as well, and the book as well, so you can check out details of it. Yeah, next. I don't know what the scribbles are on the screen. I apologize for that. But we also have created an essentials guidebook, because what we realize is a lot of patients might not be able to work with us on a more personalized basis. They're not able to do a very a long integrative program with us. So we just created a comprehensive guidebook. This is like your tool you need as soon as you're diagnosed with cancer. It tells you everything about food. It gives you exercise videos for every physical condition you might face, and also psychological videos, so counseling videos for any mental or emotional issues that you might be going through. We have sample diet plans, like neutropenic diet plans, high protein diet plans, things that you can implement yourself. And it basically tells you how to manage each one of your side effects that you're facing. So instead of going to Google and getting information from very uncredible sources, which we found was happening constantly, we decided, let's just put all our knowledge together, which is backed by science, which has worked on the ground. And this is your tool. It's really, really easy to access, and you can go through everything and implement it yourself. So this, again, we will send you the link to. You'll find it on our website as well, and you can just purchase this book. The third program that we offer now, this is a much more integrative program. This is based on nutrition, but it is a holistic therapy for cancer treatment, side effects, and improving quality of life. So over here, this is a monthly program. You work with a clinical nutritionist and a health expert. You're in constant contact with them. They monitor your food habits. They do a full assessment. They guide you on exactly what you should be eating, but will also tell you exactly what you should be doing physically and mentally as well. This is a much more integrative program, like I said. And the reason we did this is because while there are certain guidelines you follow for cancer nutrition, it is extremely personalized for each type of cancer. So whether it's breast cancer, esophagus, whatever stage or post cancer, the type of nutrition you follow is very, very, very important. And that's why we said that you have direct access to a trained oncoclinical nutritionist and a health expert who will guide you through the program. We monitor your baseline, and then we also give you reports on how you're progressing and improving. And these reports can also be shared with your doctor and with your caregivers and all of that. So that program is also available. We will also send you the link to that, and you can get more information about that. So this is bringing us to the end of our presentation, but I'm happy to answer any more questions if there are, Shamik.
Could you share that link to the these programs and the book on the chat, maybe?
Yes. So Nandita, I would request you to just do that in the meantime, just the link to our website, to the recipe book and the programs as well. If you're interested in it, you can always just write to us. I will also put, Nandita, if you can share our contact details, and you all can just write to us as well, or, email us or call us actually regarding any of the programs. I think there was a question regarding where to buy this Wow. So Wow Nutrition is basically a probiotic. It's a probiotic I take personally myself, and you can buy it on Amazon. Yes.
Cool.
Okay.
Yeah. Are there any other
other
questions?
questions?
Yeah. You can also just come on chat and unmute yourself and ask as well if you want to. But today's today's thing was really information packed, right? There was a lot of information today in the
Yes, we didn't want to put too many slides, but it's very difficult because there's a lot of information to share about cancer, and it's very important that you get the right information. Um, so in that sense, we had to, and we've only actually just covered the surface of it. So we urge everyone to get in touch, and we can help them further with nutrition. If it's all right, I can, okay, I think they're asking again about the CBD and hemp. So I will just put it on to someone called Shivraj. He's actually working with cancer patients currently and can tell you a little bit about the CBD and hemp very quickly, if that's okay.
Sure. Yeah.
Hello. Yes.
Hi,
Hi.
Shivraj.
Hi. I hope everyone's having a good day so far.
Yep.
Right. Okay, great. So I believe there was a question that someone had regarding neuropathic pain and CBD oil and how it affects and helps in neuropathic pain. So CBD oil has natural compounds that are high in anti-inflammation and analgesic properties, which means anti-inflammation and pain relieving properties. So what they do is they latch on to the pain receptors in your nervous system and in the rest of the body, and they calm down the pain signals, thereby reducing the pain and bringing the inflammation down.
And what are hemp hearts?
So hemp hearts are basically dehulled hemp seeds. Yeah, they're very high in protein content. So CBD oil doesn't, and hemp hearts are two completely different things.
Got it. Cool. Okay. Thank you, Shivraj.
All right, you're welcome.
Okay. I think that's about it. Thank you so much, guys. And is anybody posting the link here now? Otherwise, we can post it in the Farmizan app as well.
I am okay. I'm just gonna post the link to our
No,
website.
just posting it on the chat box.
Yeah, just give it a couple of minutes, and
Sure.
Nandita will post it.
And these hemp seeds can be consumed directly as well, right?
The hemp seeds, yes, can be consumed directly. And they are high in protein. So this is something you can even sprinkle on your salads, or you can put into your smoothies. So this is something can be used in your food. And by the way, with the CBD, I do want to mention, because I have a lot of patients taking it. So it has been completely legalized in India. And there are companies that are actually providing legalized CBD for clinical purposes. We have seen substantial improvements in patients taking CBD for nausea, for appetite, for pain management, for anxiety, for sleep. So if you want to know more about that, you all can also reach out to us about that. We can tell you what are the good sources, because again, you will see that there is a lot, people are doing, but you need high quality CBD and THC. So we can, kind of direct you to the right source of actually consuming this.
Got it. From where can we purchase your CBD?
So the CBD can be purchased. What we'll do is we'll send out a link, and we'll with a number. I think we'll just put in a number right now. I'll give you a number right now, and you can actually reach out to the person directly. 98185 211. Yeah. So you can just reach out to this person for the CBD. All the Nandita has shared the link to our programs. Our recipe book as well, Nandita, if you can share that link.
Sure.
Cool. I'm just waiting so that people can note it down.
Yes.
Links, etc. Jayanti, did you have a question?
Yes, hemp is also, I'm just going to answer Tanvi's question. Hemp is very safe. It's like CBD, it's a very safe substance to take. A lot of people just take hemp protein powder as well. It just doesn't taste great, but it's very, very, safe to consume. I'm just sharing the link to the recipe book. You all can have a look at that as well. So what we will do is we will send out an emailer with all these links. I think we just got one more question about the CBD. Is it a topical app? Okay, so there is a tincture that you can consume, and there is a topical application for pain. So yes, so it can be consumed in terms internally is the tincture oil, and then there's a pain management one, which is a topical. But like I said, if you can get in touch with that number, and he should be able to help you with the highest quality CBD and all your questions regarding the same. So shall we, if you have any further questions, would it be possible if you all can email us, and we're happy to get on a call with you or respond to your question by email? Or else we're happy to answer it now. I think Jayanti had a question regarding improving white blood cells. So Shamika, I leave that up to you if you would like us to answer.
Yeah, you can take this last question maybe.
Okay. Nikat, do you want to take this then?
Yeah. Improving our white blood cells in regards to blood cancer. Yes, with food, yes, to some extent you can, but because it's the disease that specifically affects your blood cells in the body, you'll have to keep a check on it, and you'll have to keep doing practicing those remedies on and off. It's not that you practice today and then you stop it, because if you do that again, it'll have an impact on your other blood cells, for example, your RBCs, your platelets, or your hemoglobin, or your WBCs. So yes, with diet, definitely you can, and you will be able to help your blood cells, even your white blood cells, or even your RBCs or other platelets, with regards to the diet. Yes, you can. And
yeah,
need,
sorry for the interruption, ma'am. Like any particular this thing will diet follow for this one?
Okay, now
Any
for
particular-
example, if I have to give you like a simple remedy, I would say a wheatgrass juice can help in improving your WBCs, and at the same time your hemoglobin as well. So yes, something as simple as that you can practice on a regular basis.
Okay. Thank you.
You're welcome.
Any other questions or can close the session?
Cool. I think mm, okay, wheatgrass powder should you have, or should you have fresh
A
wheatgrass?
fresh one is always better, but in case if you're not able to find the fresh one, then wheatgrass powder will also do. But as long as it's free of any other additives.
Got it.
Actually,
Any-
homegrown wheatgrass is the best. If you can actually grow it in your home and actually make sure it's cleaned very well. Very important to, if you're on chemotherapy, it's the best way to consume it. Or else you can get in touch with us. We know a couple of people who send frozen wheatgrass, but it's very high quality. So you can get batches sent to you on a weekly basis or whatever.
Okay. Yeah, apart from that, man, like any other this thing, like apart from wheatgrass.
In order to improve. Yeah, go
Hello.
ahead, sir.
Yes, can you hear us?
Yeah, yes.
Yeah,
Yes,
so
ma'am.
it really depends. Yeah, anything else, Nikat, for the white blood cells?
No,
Uh,
actually regarding that blood cancer patients, like any other specific diet to follow for them. Hello.
Yeah, so for that, I cannot really tell you anything in specific, but yes, it depends from again person to person. So, and depends on the kind of symptoms, and I'll have to actually see all the blood reports and the blood parameters as well before giving any particular suggestion. So, in case if you could just give me a little bit more of information regarding the patient, then maybe I think I'll be able to help you out.
Yeah, yes, ma'am. I will just share the details with the mail ID you have just forwarded, right? Hello.
Yes, yes. So what you
Yeah.
can do is you can just reach out to us. We'll put our email ID here as well, and number,
Yeah.
and we can then help you further.
Okay, ma'am. Yeah.
Yes.
Thank you.
Yeah. So we have shared our email ID and number over here. For anyone who wants to reach out, please feel free.
Yeah. Thank you, ma'am.
All right. Thank you so much. Thank you for your time, and we will send you all the information via email as well.
Okay, thanks, Samara and team. This was excellent as well. Thank you. A lot of very useful information. Take
Thank
care,
you.
guys. Bye
Thank
bye.
you.